Okay, so hi everyone. Thank you all for coming out today. My name is Lydia, and I'm one of the events directors for Interasian Council. And I'm super excited to introduce today's speaker, Emilia Nuroshiro, who's a doctoral candidate at the Hopkins Bloomberg School of Public Health in the Department of Health, Behavior, and Society. Amelia is a social and behavioral health scientist and activist, and she aims to further scientific knowledge on how to minimize mental health disparities in adults that identify with various stigmatized groups. She has also taught a Gordis Teaching Fellowship course about the link between depression and minority mental health at Hopkins last semester. So without further ado, I'll have Amelia get started.
All right, thank you, Lydia. Hi, everyone. Thank you for coming. I am really excited to be here and talk to you all kind of more interactively about the topic of racial health disparities and COVID-19. So Lydia and Charlie, who are here, were in my course, the Minority Mental Health course, and we talked about and learned about how oppression is linked to disparities or inequities, actually, in health outcomes. And Lydia, can you maybe talk about or touch upon what you thought made the course relevant to talk about today?
Yeah, so in the course last semester, we learned a lot of theories and basically the mechanisms as to why individuals who identify with certain stigmatized groups will exhibit or have patterns of maybe like higher rates of depression, higher rates of mental health issues overall, because they are experiencing like a lot of like accumulation of different factors. So for example, discrimination, stress, a lot of these different things all compile together, which result in minorities having these higher rates of health outcomes. And I feel like the mechanisms we learned in last semester are very applicable to why, or partially why, some of the minority groups are having more severe health outcomes in terms of COVID-19.
That is such an excellent summary. I really couldn't have said it better myself. And based on what Lydia said, I would love to open up the floor to questions from you all. I can answer questions directly on anything you're curious about that you've wondered over the past, 6 months. And, I'd love to get your thoughts and feedback on what you think, the responses I give. And, it's not just, Q&A, it's really a discussion for me. So to begin, I think one of the big points that Lydia mentioned was about stigma. Stigma is a fundamental cause of health inequities. So, you might be hearing the word disparities a lot in the news and in many articles. And the word disparity is almost like a misnomer. I mean, it's not really conveying what you think it conveys. I think in lay language, when you're talking to people, you'll say, oh, there's a disparity between this income and that income. And a lot of people think of the word disparity in terms of a difference. And, I don't think that really captures what we're trying to look for. A disparity is not something that's going to talk about the structural determinants of health. And what I mean by that is that there are ongoing mechanisms that have been built in place in this country since its inception and before, the country was founded, to make sure that people of privilege remain at the top and consistently stay at the top over the course of time. And that doesn't just create a disparity, that creates an inequity. And that inequity in and of itself is something that perpetuates over time as well and gets worse over time. And that's kind of what we're seeing right now. It's not just that COVID came and this one particular disease is causing some kind of inequity or disparate health outcomes. It's that these mechanisms have been in place and there are many health issues that go under the umbrella of health inequities. So the term health inequities and health disparities actually comes from a lot of the literature and is supported by the National Institutes of Mental Health Disparities, of Minority Health Disparities, excuse me. And the diseases that actually go under health disparities include asthma, cancer, cardiovascular disease. There's disparities in suicide outcomes, between like male and female. The rates of, for example, Indigenous and Native American people, having deaths by suicide is higher than almost any other race. So, you know, when you really think about the mechanisms that have been in place, you could think about the keyword stigma, like Lydia mentioned. So if there's any questions up till now on what I described, feel free to chime in. And I will talk a little bit about stigma. So I mentioned at the very beginning of when I was beginning to talk that stigma is a fundamental cause of health disparities. So what is stigma? I think people really undervalue the word stigma. What would you say, Lydia? I don't want to just keep talking.
I would say stigma in terms of maybe when we're discussing minorities, kind of these underlying maybe biases or notions that people have about minority groups and kind of associate with these groups and kind of therefore act differently maybe towards them or have different attitudes toward them.
Yeah. So a lot of times stigma is used as a replacement word for prejudice or discrimination. And I wouldn't necessarily disagree with that, except stigma is something that is almost like a larger kind of, excuse me, concept, something that really spans beyond prejudice and discrimination. Stigma is actually created and enforced by a social class. So what that means is that, you know, we have people in power. Power can look like, you know, money, social status, anything that is kind of a currency, right? Like you can have social currency, you can have monetary currency. Whoever is at the top of that currency essentially determines what is a cultural norm. And when you determine what a cultural norm is, you can determine who is a part of that cultural norm and the standards that go with those cultural norms, and then you can determine who basically isn't a part of those. And so it really becomes this kind of binary situation. So in modern society, what that looks like is, you know, white culture, white people, white standards become the cultural norm of what it means to be an American. And this is what we term as white supremacy, right? It's not just, you know, KKK wearing their, you know, their outfits roaming around. White supremacy is really something much more deeper entrenched into the cultural fabrics of the American cultural understanding. So what that really has implications for is the types of policies that we create to make sure that whites stay healthy, that whites have longer life expectancies than blacks, for example, up to 15 to 20 years, depending on male or female or other genders. And that creates this kind of system of, you know, we are the norm and everyone else is not. And so when everyone else is not, there's varying degrees of stigma associated to those people. And, you know, if you look at, you know, sociologists and the way they define stigma, a good way to look at it is, you know, the other, whoever is the other. So, you know, different populations of, you know, race and ethnicity in this country have had histories of being stigmatized. So in the chat function, feel free to, you know, mention some examples of, you know, people who you know or groups of people that have been stigmatized over time in this country. And one thing I will mention is right now, Asians are being stigmatized, especially East Asians. Yeah, so Lydia mentions LGBTQ plus groups, the homeless population, um, immigrants, yeah, people who use drugs, yes, great. Sex workers, yes. Any others? Okay, so the key thing that you'll see running in these responses between like LGBTQ plus groups, homeless population, um, immigrants, people who use drugs, sex workers, the key thing is they don't fit the norm and they're usually not accepted in society to some degree. And, you know, depending on how you define society, right? Society varies, you know, you could be at the national level of being American, or you could be a state level of being, you know, in California or in Maryland. And then you can look at the city level of like Baltimore. you're going to have different enclaves of what is considered quote unquote normal, and where the cultural norms are. But when you look globally, right, when you look globally from a very like 40,000 foot at the top of the mountain kind of lens, you really understand that the people who have had origins and heritage in colonial countries like Europe have had dominance and power and currency over the history of time, the last 200 years to 400 years, with the most major impacts on what we look at, the outcomes today. So in terms of stigma, what it does is it creates laws that make sure people do not get access to the things that will help them in any single way. Like it could help them in their income, it could help them in their health, and those are very much linked. So for example, let's take a look at African American / Black folks in the United States. So we had slavery in this country, right? Slavery had existed for 400 years, and it's still alive today, just in a different form. Many of you know this. So, slavery was supposedly abolished. Just because it was abolished in law doesn't mean that it was actually enforced. There were several Southern countries, namely Texas as well, that didn't actually care that this was some kind of federal regulation, that slavery was abolished. They continued practicing slavery, and to this day, actually, the Southern states, really have this emblem of the Confederacy as a part of their cultural icon, and this kind of relatability to the history of, the Civil War and all those things. And what that really does is, over time, it really creates this idea of, we don't like you, you're not a part of us, you're not normal. And so, we restrict people's voting rights. We restrict their civil rights, and that's when you had, the civil rights movement and the Jim Crow laws preceding that. So, those Jim Crow laws were meant to reinforce that stigma, that even though these are supposedly free people, we're going to keep using these, policies as mechanisms to keep them under control and to restrict their access to, a democratic government. Because if they, have the power to vote, then, they can essentially skew the way that this country goes. And so that's where the term disenfranchisement comes from, is that you take away the people's right to vote. And if I'm saying stuff that you already know, please ask the questions and I can, advance the conversation accordingly, because I don't have any idea where some of you are coming from, if you have any social science background, history background, etc. But, when you think about what happened after the civil rights movement, it's not like Black people are walking around this country like everything's cool and chill and normal. That's just not the case. Up until today, there are several like large pockets of, communities and areas where there's just no voting booths. Like I was actually listening to a talk from one of my colleagues, and she was actually describing just between the 2016 to 2020 election alone, we're going to see a reduction of voting booths, not just from the pandemic, but just in general, like how they're being registered. The places where there is a large minority population, there's a very deliberate intention to make sure that there's fewer voting polls there with larger amounts of people, like up to one voting booth, she said, to cover like a population of like 600,000. So, imagine waiting in a line for that long. So that's disenfranchisement too, having voter restriction laws, making sure you have your ID and all these like silly little, regulations to make sure that you're not going to have access to voting. And of course, let's not forget, when I say modern day slavery, we're referring to the prison system. So, we have 1 in 3 Black men in America is going to be a part of, the prison system in their lifetime. And that is a given. And when we think about that, we think about them not being able to have a right to vote. And they're also not integrated into society, right? And what does that mean? They are othered, just like I mentioned before, they're othered, and they're essentially cast off. And, people have very stigmatized ideas of who Black people are. And because of that, it's kind of this reinforcing notion. So it comes from the top. It's like, okay, Well, the government says you don't count as a person, right? So like back in, the first US census that was released, I believe in the 17 or 1800s. I have to go back and check, but Black folks didn't even count as an actual person. There was like 3/5 of a person or whatever, because they were just counted as slaves. And only the white people were counted as actual people as part of the population. So imagine the dehumanization that goes into that, right? And if you're interested in learning more, just type in Pew, PEW, census history in Google, and there's a really cool interactive module that you can actually go through and see how people's racial identities have been defined. And that actually ties really into how they've been stigmatized. So, race, as we know, is a social construction. And what that means is we made up racial categories. And because we've made them up, we can also allow ourselves to make up who is in and who is out, who's stigmatized and who's not stigmatized. So I imagine that you didn't come in this talk thinking that we're just going to talk about stigma and, racism and stuff like that. I imagine you thought it was going to come around to COVID eventually. And so if you want to talk about COVID, we can talk about that. But that's definitely the building blocks that we're talking about here. And one of the things that I think would be a really good propelling point from this point is to perhaps look at how East Asians were stigmatized during the initial kind of shutdown of the pandemic and kind of the build up to the pandemic. One thing that's really remarkable about how this entire pandemic was framed in this country was there was a big push from the administration, the Trump administration, to call this a China virus or the Chinese virus. And there is a history of, racist nomenclature of diseases in the public health world. I mean, in the world in general, right? Like we refer to MERS, the Middle Eastern Respiratory Syndrome, right? Like that is a very, it's supposed to be geographically located and it's supposed to convey some kind of, there's actually like not a formula, but there's a system to classify these diseases, based on their taxonomy. And unfortunately, because they're, geographically located, they can also end up being weaponized in terms of being racialized, right? So Middle Eastern Respiratory Syndrome, MERS, then becomes like the Arab disease or something like that, right? Like there's these racializations of what diseases actually mean. And so when we think of COVID, Trump had mentioned, like, let's call it the Wuhan virus. Well, I mean, what really does that serve? What benefit does that serve in terms of understanding the disease in and of itself? No, it doesn't serve any benefit. I mean, if you look at even the MERS virus, it was originally called some kind of, SARS origin type virus in its name. And same with coronavirus. It's a coronavirus, not just COVID. And co is the corona and vid is virus, disease, So, that comes from just the scientific nomenclature. So why call it the China virus? Why call it the Wuhan virus if it's not to just stigmatize other people who may be perceived as Asian, even if they aren't Asian, or people who are Asian and identify as Asian and therefore become even further stigmatized in this country. So the interesting thing is actually Asian Americans in this country who are not like foreign-born first generation immigrants are one of the most burgeoning socioeconomic classes in this country. Yet you see this intersection, right? Like you would think that if you have a lot of money, like you're rich and you're like part of the upper class in this country, that you would end up being the ones who create the social norms, right? So like theoretically, you could even say like, oh, well, Asian people determine who's in and out, who's stigmatized and who's not. But that's the legacy of white supremacy, essentially, that, in this time, there's always going to be something, like I said, different groups over the points of time where, you're the it group. And no matter how, powerful you have in some form of currency, like socioeconomic status or some other social status, White supremacy tends to trump that. We see that even with, the differences in terms of job prospects and income for a white person who has a high school diploma versus a Black person who has a college degree. And by the way, the major distinction is that the white person has a criminal record, and the Black person doesn't. And, a study found that the Black people who had no criminal record and had higher education actually did not get as many callbacks for interviews as the ones that were white, had less than a college degree, and had a criminal record. So that should speak to, just because you're successful in terms of the metrics of being educated, in terms of having a higher socioeconomic status, doesn't actually amount to anything. It really just comes down to, are you part of the white class? And that in and of itself acts as the mechanism to make sure that you have the privileges of good health. So let's open it up to questions, and Lydia is going to moderate, and I'll just be here waiting for the questions to trickle in.
Yeah, so you guys can type your questions in the chat and I can just read them out loud.
Yes, and I'm happy to interact here too. So in the past, we've had Estelle, Alicia, Jun.
Oh, okay. Paul asked a question. He said, what do you think are the most important lessons for the next pandemic?
Okay, so I'm going to try and frame this in terms of the racial disparities. So the most important lessons for the next pandemic, hopefully we don't have another pandemic. I think from a public health standpoint, I can talk about that a little bit before I get into the racial disparities. And from the public health standpoint, I'm sure you all have seen like the whole Bill Gates thing, him predicting like the next really big pandemic is going to be a respiratory nature and, blah, blah, blah. And that is really the case. I mean, we really have to prepare for something of this nature. And that involves, systematic testing, regular testing. But, that's really not just the only thing. Testing in and of itself is something that requires a lot of resources. And in the class, we talk about the notion of resources being not just like, monetary resources, but also flexible resources like power and status, right? So for example, in this state, in Maryland, you all know that Governor Hogan was able to procure like, what was it, how many thousands of tests early on into the pandemic because of his, political ties to Korea, right? Because his wife is Korean. And, Koreans were really on top of the whole like testing procedures and really like mitigating the risk for transmission, getting everything under control. But, that political tie is something that you have as a flexible resource. That's not something that you can just, theoretically you really can buy that. But why Maryland, right? Why not like, Texas? Why didn't Texas get these coronavirus tests? There aren't these political ties there, and that's kind of like a flexible resource, right? So unfortunately, the lessons for the next pandemic, it's kind of worded as a question as if we can almost prepare for it in like in the sense of racial, like reducing racial disparities. But the fact of the matter is, like I said at the beginning, the inequities are actually in place to perpetuate for the rest of time. So it's kind of like, it's kind of like you start like, I don't know if this is a good analogy, but you start on a boat, you start sailing in the ocean. And it's like, by the time, you keep sailing, at some point you just get so far lost, like there's no starting back. Like the only thing that could actually uproot the disparities and inequities that are caused by global diseases are if you completely revolutionized and reversed the entire system of who's at the top. And so essentially that would be like undoing racism, undoing sexism, undoing homophobia, undoing ableism. So how do you actually undo that when that actually becomes internalized within people's psyche? I mean, you all are students at Johns Hopkins University. I'm sure many of you have struggled with things like imposter syndrome, things like, discrimination, prejudice, feeling like you don't fit in. Maybe you're not Asian enough. Maybe you're too Asian. Maybe you're too immigrant associated, or maybe you're not too American. There's all these different facets of your identity, which end up being, pushed and pulled and pushed and pulled, and you don't know where you end up belonging. And that's because you've really internalized this notion of, seeking acceptance from the group that's in power. To the extent that you have to kind of change your appearance, you have to change what you wear, you have to change your accent if you have one, you have to change your hair to make sure it looks right. You have to do all these things that, in your head makes you think that you're going to get accepted by people. And really, that's just an internalization of the standards that have been put out there, from like this governmental level, from this cultural level. And I'll give you a really good example. I'm sure many of you have eaten sushi. Like, sushi is one of my favorite things. Sushi was not something that was, just became a part of common culture in America. It very much was kind of this like upper class ordeal. Like, apparently, there was a scene in one of these movies that Audrey Hepburn was in, and it might have been Breakfast at Tiffany's. I'm not even sure. But she had these little chopsticks, and she was eating sushi. And people were all curious about this. And they were like, what is she doing? What is she eating? But, it's like, oh, wow, she's doing that. So that's really cool. So I'm going to be like her because she's this movie star and blah, blah, blah. So, we all know that whatever movie stars do, then like the next day we're all doing that, right? Like I mentioned in the class, the example of Mean Girls, and how, the whole thing about, the girl who was at the top, she like cuts out something in her tank top, and everyone the next day is starting to sport that at the school. And that really creates this idea that we really need to be like the people who are at the top, and that perpetuates. So even if we were to try and address the next pandemic, by like having every single public health measure in place, right? Like the testing, the social distancing, the complete like quarantine of people, all of that stuff. Even if we were to put it in place, the pandemic was still rolled out the way it rolled out today. I think the only difference would be the number of cases might be a little bit smaller. Maybe the spread would be a little bit slower, but you would still see those inequities, right? Those disparities in terms of the number of new cases and the number of ongoing cases, the prevalence, right? So, and that really speaks to the fact that you just won't have something that's just going to end because, we have a supposed vaccine in place. So I'd be happy to continue talking. What other questions are there?
I actually had a question. So one thing that really stuck out to me last semester in your course was learning about the minority stress model. So first, do you think you could explain to everyone what that model is? And then second, how it might apply to why Black populations right now are experiencing like worse health outcomes from coronavirus than white populations?
Yeah, that'd be great. So minority stress is a theory, and a theory that has a lot of data behind it, that actually talks about the way that minorities, particularly that theory was made for non-heterosexual people. So in terms of sexual gender minorities, it talked about how there's like this burden of mental health that comes with, experiencing rejection and experiencing laws that are essentially made to outcast you based on your sexual gender identification. So, essentially that because you've experienced these laws at a governmental level and even at a state level, like there isn't any accommodations for you at the city level, and then even at cultural community level, right? Heteronormativity is, the norm. So when you have that in place, you essentially create this cycle of, okay, well, I need to reject myself if I identify as queer, because that would mean that I could get accepted into a heteronormative society. And when that happens, it's like you're internalizing it, right? And so there's all the whole, there's like a really big push to have pride, which is a rejection of that rejection, right? It's to take pride and acceptance of oneself. And so the literature basically talks about that there's a higher rate of psychiatric disorders among people who are queer. And that is because they face greater discrimination, more perceived discrimination, as well as structural discrimination, more prejudice, more bias, and then they internalize it, right? And that theory has expanded over time to include racial minorities and other minorities who, and not to say that, right, it's not to say that there aren't racial minorities who are queer. It's that, taking all these identities together intersectionally, you experience a certain amount of exposures as to how much rejection you will have, right? So, for example, you may experience rejection because you're a woman or you identify as female in a certain space, right? You may experience rejection for being trans. You may experience rejection for being Black, brown, and female or trans. You may experience rejection for being Black, brown, female, or trans, and someone who is of lower class socioeconomically, right? So when you have all these kind of identities that relate to structural oppression systems, you have the heteronormativity, you have the sexism, you have the racism. When you have all of these kind of confluencing into one major kind of power oppression system for you, it essentially creates this dynamic within you where you're like, well, I don't belong here, I don't belong there, I don't belong here. And it stresses you out. It's really just that simple. It causes this level of stress in your body of, hypervigilance. You're constantly psychologically trying to be aware of where there's danger, where someone might, cause harm to you. And so you're trying to always look for safe spots around where you are. You're trying to make sure that you know where the exits are. You're trying to make sure, you have eyes on the back of your head. And think of Trayvon Martin, so many people today, who are young Black kids, just cannot exist, just exist, because of something that is not in their control, their skin color. And that's been completely, it's been completely constructed as this negative thing. And, these biases that are connected to it, it's been completely demonized and dehumanized. To really understand that dark skin, is bad people. Dark skin equals bad people. And so what that does is when people are actually aware of this, because if you're not necessarily aware, there's differences, right? You may perceive discrimination more if you're more aware of that discrimination exists, right? That's why you have so much variation in how people perceive discrimination and then appraise it as something that's stressful. So when you are bombarded with that much stress in your life, that actually produces inflammation in your body. And inflammation is one of the key mechanisms biologically that affects the way you are able to, that affects your susceptibility to disease and the way you're able to fight off disease. So not only is there kind of this structural built-in process for, in COVID to make sure that, people in highly dense living areas, which are obviously people who are racial minorities, and urban populations are generally racial minorities in terms of the majority race. Not only do you have that kind of built in, but then you also have the kind of internal mechanisms biologically, right? You're experiencing greater exposures to violence, greater exposures to trauma, greater exposures to stress. And that wears on your body. And we know that there's a mind-body-gut connection. So, what happens stressful in your mind then affects your internal systems, your gut, and that gut has a microbiome, and that microbiome gets disrupted. And when you're not able to get, the proper nutrients and the proper oxygen that you need, literally oxygen, you cannot breathe. Like, you cannot breathe. I cannot breathe. The like characteristic understanding of what Black Lives Matter is essentially about. I cannot breathe, right? That essentially, it wears and tears on you, and it weathers your ability to maintain homeostasis. So, in our class, we discuss the weathering hypothesis. We talk about, minority stress theory and all that. And, essentially with COVID, it's like you have those double-ended reinforcements. Like, not only are you going to experience racism and therefore health inequities, but then we're also going to really destroy your body and make sure you can't recover from a disease because you have so much stress and so much inflammation that your lungs are not going to work, and they're just, you're going to have long-term, lifelong consequences to this disease. And you're not just going to recover because, like privileged people are going to recover, because you're going to continue being in environments that are going to continue giving you exposures to stress, and you're going to continue to perpetuate that trauma generationally, right? Because you're not going to be able to, for example, be there for your kids because you're going to be sick all the time. And you're not even going to be able to go to the doctors because you're not going to be able to have time to go to the doctors because you're not paid enough in terms of a salary. You're paid on a wage-based job and on an hourly job. So you're going to have to take time off just to go to the doctors, but then who's going to feed your kids if you go to the doctors? So let's just not go to the doctors. And then let's just wait until the problem gets really bad, and then you end up having to go to the hospital or something. And then all this stuff like just keeps piling on, and it perpetuates. It's like really an ongoing mechanism. So it's a lack of access to healthcare. It's a lack of access to quality medicine. It's a lack of, socioeconomic ability to get the type of treatment that you need, right? The type of prescriptions that you need. For example, asthma in and of itself is not something that's necessarily covered by insurance. Most asthma medications actually require you to pay out of pocket. And I know this because I pay a good amount every month for my severe asthma. And asthma affects minority populations disproportionately, especially people who are in urban environments, because they're constantly exposed to irritants and pollutants in the environment. So cockroaches, buses that expel gas, mice, the subway system, every single thing that's out there to really irritate your lungs is there. So if you're a racial minority in an urban setting where there's a high density housing situation, you're not just like in the suburbs, like where everyone has their own little lot. If you're in all that, plus you're exposed to, trauma and violence from, the crime that's happening around you that's not under your control, and you don't have the income to move out of this environment, then you're going to be under a lot of stress all the time. You're going to be exposed to asthma. You're going to become high risk. You're going to experience the symptoms of COVID a lot more seriously and have deaths because of that, right? So that's kind of how that all goes. Any other questions?
So John asked a question. He said, given the complex intersectionality of social, political, and economical and medical factors that have contributed to the persistence of racism in America, racism and discrimination is also something that we witness in the medical community. Do you think that universal health care can ameliorate the inherent inequity providing good medical care?
Okay, great question. We actually covered this in the class. I don't know if you remember, Lydia. But we actually talked about, when I mentioned, the whole revolution thing, like we just need to revolutionize, the whole health industry and social revolution in terms of undoing racism and all that. The question remains, can you actually fix the problem, fix the inequity, if you bring about these interventions like universal health care? To me, that's almost like saying, let's bring about socialism and we will see a change in racism and other things. And you would be right to a certain degree, right? But that would be like erasing everything that happened in history and starting up on a new page. You could do that, but it would take hundreds and hundreds and hundreds of years. to try and actually undo what's already happened. So colonialism has existed for a long time, a long time. And if you were to decolonize the kind of psyche first, if you were to decolonize whatever internalizations you've had around being like European people, and then start changing laws to be like favoring minorities, start changing health systems to be favoring people of lower socioeconomic status, you would actually have to fundamentally change the definition of what it means to be low socioeconomic status. You would have to change the definition of socioeconomic status altogether. You would have to get rid of the idea of socioeconomic status. You'd have to talk about there's no class. There's no difference between socioeconomic, classes. That's classism, right? I was actually at Target the other day. This is just like a quick segue, tangent. I was actually at Target on Sunday, and I had a very large purchase, and I had a coupon that was like for $20 that was for whatever reason not working. And there was a white woman who was behind me, who was upset that she had to wait another, few minutes in line behind me. And she started making a ruckus about it. And, I'm like trying to figure this out with the store clerk. And at the end of it all, I told her that she could go to any other lane if she wanted. And all the lanes were open. There was like literally no one in any lane. And she told me, she got like the customer service involved or whatever. She got, she like got the management involved. And I'm like, oh my God, I'm just trying to get a freaking coupon. And she actually like got the management to open up a separate lane just for her. And she went and like under her breath, but very loudly under her breath, she told me, she was like, I could have just given you the $20 to save you the trouble. And, that's very like racialized comment. It's like a very racist comment and a classist comment, because it essentially points to like, I'm too poor to afford a $500 Target trip. And if $20 means so much to me, she could have just paid it. She could have just paid it for me. And it's like, do you even know like where this stuff is going? Like I could be literally donating this to some nonprofit because they asked me to shop for them, but it wouldn't matter to her because she has very deep entrenched notions of what it means to be darker skinned in this country, right? So she's lighter skinned, so she assumes I can't afford the $20. Or that I need the $20. And so this whole notion of classism, that's not just something that gets fixed by universal healthcare or, socialism and stuff like that. It's something that's so deeply entrenched that when we do it, it might reduce the intensity of, the racism or the inequities. It might reduce the intensity of it, which, yeah, we will save some lives, but we're not going to necessarily change the lifespans of people, right? Those lifespans, those life expectancies that have reduced by like 15 to 20 years are going to stay that way for a really, really, really long time, because guess what? Racism is violent. It's a traumagenic experience. It creates trauma in the body, and the trauma stays in your body. It actually changes your DNA epigenetically. There's a whole bunch of research that talks about the interaction of the environment, social environment and physical environment, and whatever genes you are born with genetically, biologically, and how that discrimination is in and of itself so traumatic that your response to it, right, your hypervigilance, your stress, your, all this stuff that your body is producing cortisol for, essentially translates down generations up to like 6 generations later on, continue to have these similar health effects where they cannot maintain a homeostasis within their body. So imagine right now, if we just implemented universal healthcare in the middle of the COVID pandemic, what would happen? Would we reverse the cases that were originally there? Would we reverse the health effects that people who already experienced? If we were right now to just issue tickets to everyone equally, right? Equally, we just issue a ticket to everyone, say you have the right to access a high quality doctor, the same type of doctors who treated Donald Trump when he contracted COVID, okay? You have the same chance of having that kind of doctor as anybody else in this country, do you really think we would undo the health disparities? No, because first of all, that doesn't just happen overnight. You would have to have so much regulation that by the time you even figure the first step of it out, honestly, COVID will be wiped out from this country. Like, that's how long it would take. And you see this kind of, you can kind of see the United States as a microcosm of the whole world in terms of this power dynamic, right? So for example, measles was eradicated in the United States. And it became a disease for countries who are in developing economies, right? So now you see, countries in Africa, countries in the Middle East, still struggling with measles and containing measles. Now that's an infectious disease, right? That's by nature, as an infectious disease, it's categorized under the same category of like communicable diseases, just as COVID is, right? But the difference is that the United States has had the power, the resources, the flexible resources, the economy, the everything, the research, the healthcare, everything kind of confluencing together to make sure that measles could be eventually eradicated in this country. And even though there's small outbreaks of measles, like in Orange County or whatever, in California, that it did not necessarily lead to these huge, like, epidemic type proportions of measles kind of resurfacing as a public health issue, because we've had the ability to contain that, because we'd already done everything before, and because measles is something that we wiped out already. But it became a disease for the rest of the world, and that's where I think COVID is eventually going to end up going. We're using all these other populations on Earth to test the vaccine, and essentially using them as our laboratory to make sure that people in America can have a vaccine and function. So, universal healthcare in this country may solve a little bit of a big pie of the problem, but it's not actually addressing the root causes. And essentially the dynamics that happen in this country is kind of a metaphor for what happens for the rest of the country. Not a metaphor, but actually an example of what happens for the rest of the world, is what I'm trying to say. Really good question. Thank you, Jim. And what else?
So Jonathan asked, what is your opinion on Middle Eastern and Hispanic individuals still having to identify as white on the 2020 US Census?
Okay, so my scholarly stance on having the white racial categorization on the 2020 US Census is that, it's just another way to make sure that health inequities persist. So in terms of, so my training really involves critical race theory. So if anyone is interested in critical race theory, let me just pull this up for you. I have a book that you may be interested in that really goes into this, Richard Delgado and John Stefanich, Critical Race Theory. It's really, really good for you to look into. And it's actually a major part of my dissertation. Essentially, what it talks about is that racial categorizations and white supremacy is there so that, we can make sure that people who are not white essentially continue to not flourish. And when you categorize people as Middle Eastern and Hispanic on a census, you're categorizing them the same as Europeans. People who are Middle Eastern and Hispanic generally did not come here on the same timeline as Europeans in this country did. They generally did not come under the same circumstances. They generally did not come, with the same privileges. For example, and we've mentioned this in the class, we've mentioned how if you come from Egypt, right, that's North Africa, and the very northern parts of Egypt, you'll see people who are light-skinned, and the farther south you go, the darker skinned it gets. In fact, you get so dark-skinned that it's very difficult to kind of distinguish who's Egyptian, who's Sudanese. And of course, these borders are all made up, right? But it goes to say that, when you come to this country as an Egyptian, you're actually classified racially as white. So if you happen to be darker skinned Egyptian, and you have to fill out white on the US Census, like the 2020 census and every other census, in the recent times. What part of your experience is actually white? Do you actually experience the same privileges as white people? Do you experience the same kind of, do white people experience the same kind of discrimination as you? Do they experience the same kind of prejudice and bias as you? Do they have better access to healthcare as you? That's the really key distinction here. So there's a really good paper in the American Journal of Public Health that came out this year, or it might have been last year, 2019, that actually talks about this. So Middle Eastern / Arab being identified under white on the US Census category is just another way to make sure that people are not stratified by the disparities that actually occur on their racial lines, on their ethnic lines. So, there's a lot of differences. Sorry, I just got interrupted because I think there's a comment here. Estelle Young. This is actually the same on college applications. There's no option for Middle Eastern. I have an Egyptian friend who had to apply to colleges as white. Exactly, yeah. That's like all my Egyptian friends, exactly, yeah. They had to apply to them as white. And it's so disturbing because it's like, really, what about you is actually experiencing privilege? Like right now, I'm actually applying for a fellowship, and my category of race is Asian, but that doesn't account for the intersectionality of it, right? They want to talk about underrepresented minorities, but and people who experience a lot of underrepresentation, underprivileged kind of background, and I'm Muslim. And it's like, well, where does that aspect of my identity go? Like, we're 1% of the population, but if you see Asian, you'll understand that I'm like every other Asian, in the sense that, like, we're all the same. No, the Filipinos, for example, have like some of the worst health outcomes in terms of racial minorities in this country, than other types of Asian people do, like other geographical locations. So now that you'll see, like in other kind of, there's like a movement to actually have Pacific Islander as separate from Asian in terms of a racial ethnic category. So to Jonathan's point, there's a really important distinction in kind of categorizing who is racially and ethnically a certain category, because that defines really how you experience socialization, your social aspects, your social interactions. That all really ties together. Exactly, Charlie. So especially when the Asian category covers such a diversity of Asian subgroups, some being underrepresented in spaces like higher education. Exactly. Any other last questions? And I'm happy to stay just a little bit longer if anyone's interested.
Okay, yeah, if we don't have any other questions, I think we can wrap it up because we're reaching like the end time. But I just want to say thank you so much. This was super informative, and I'm sure everyone else agrees as well. But yeah, I think, Amelia, are you teaching the same course next semester, or?
Yeah, I plan to actually. So if you're interested, you can sign up on CIS. The course is a Gordis Fellowship course, and I actually honestly forget the entire title of it because it's so long, but let me try my best. It's Minority Mental Health, the links between oppression and, I forget, the scientific links between oppression and mental health, and how, I think theory, empirical evidence, something or the other. But just type in minority mental health and you'll see it on CIS. And oh, Lydia, thank you. You just came through. Yes, Joan, I'm offering in the upcoming spring semester There's a limited number of slots, so you would have to sign up early. What is the link between oppression and mental health? Combining theory, concepts, and empirical science to explain minority mental health. Yes, that is the longest name for a course you will ever see. So yes, and if you wanted to just maybe talk about your experience, Lydia, that would be great, and then maybe we can have people show up to the class.
Yeah, so Charlie just said in the chat as well, highly vouch for the course, change the way I view health for marginalized populations. I completely agree 100%. Just learning really the reasoning why behind we're seeing like more mental health issues among minority groups is really eye-opening. And just knowing like why, I think is just like a really key factor to have, especially if you go to Hopkins, like just knowing the reasoning behind the health outcomes is a topic of interest, or maybe just in general to anyone, even if you're not a public health major, to really learn about, especially during this pandemic time as well.
Yeah, and it was so interesting how the first time I taught this course, the first ever time, like the pandemic literally hit in the smack dab middle of the course, and you know, not just you, Lydia. I had several students actually reach out to me and say, like, wow, we're actually like understanding everything that you just taught us. Like, wow, this is happening. And then, you know, it was just amazing to be like, wow, people are actually understanding this. You know, this isn't just a course you take to like knock out a requirement. This is something that stays with you for life. So
Yeah.
I'm really glad to hear that.
Yeah, definitely. So highly recommend to sign up for the course if you guys can. But yeah, if there's no other questions, I think we can wrap up the meeting. And Amelia, I will send you the recording of the meeting after as well.
All right. Thank you, everyone, for showing up.
Thank you.
Take care.
Bye.
Bye. Thank you.